Oh, I am. I'm so sorry. That's like that was on the iPad. That like you see, and my battery went off. So
that's okay. I was wondering, you were in mid-sentence and then all of a sudden you disappeared. And then I was going to also ask you, I was asking about what to do if you had too much fat, but I also wanted to ask you what happens, can you put fat in the forehead? And can you shave a little bit of the forehead, put fat in the forehead? Can you shave the ankles? I wanted to ask about shaving of the bone.
Okay, so yes, you can inject fat to the forehead. So again, that depended the type of and the viscosity of the fat. So obviously, having more nano micro fat will works better for the reason we have discussed, to avoid lump, to avoid irregularities. And now shaving bones, it's always, you know, the balance between the benefits and the risk and what you try to achieve. Yes, it's possible technically to shave bone, but you can't shave bone like for many centimeters. I mean, few millimeters maybe.
Millimeters, that's it. So you're not going to get a huge change based on the fact that you've had, you know, you've had the shaving. Interesting. What's the place that people generally don't know about in terms of where they can lipo?
It's me struggling holding my phone now because normally I have my iPad. So could you just repeat this question?
So where's the place that no one knows? So like some of the places that you can do liposuction that I think is really interesting, and do fat transfer.
You can remove fat from the back of your shoulder right here, below the neck, where you have this bison one, like the fat. You can from your arms, from down to the elbow.
Aha, that's what I was going to ask you for the arms. So what do you do for the bingo wings?
So again,
other than exercise.
So you can do a part of a liposuction and a skin tightening. Depend. The extreme would do an arm lift, but right now, I think like I'm seeing my iPad restoring, so maybe it will work. For bingo wing,
today the internet is crazy. There we go. Sorry, I didn't hear that. I lost you for a second.
So bingo wings, I can do liposuction, skin tightening with the body tight, or eventually we end up by doing a small incision under the arms. So it's too bad now. Like the iPad is it's working again. And me, I'm holding the phone.
Well, if you get on it, I can always like jump on a different one. But I was going to ask, you know, when you do brachioplasty, when you
no, if you bear with me 2 seconds, okay. I'll try to it's like it's very. Can I do this? So. I don't know. Is that working this way? But
I can see it, but you're sideways. You need to put it vertical.
So I will hold it. I will hold it.
Okay. All right. Sorry about that. No, but when you do a brachioplasty, where is the scar from here all the way up? I also get that quite a lot. So that's something in my office that's very difficult to treat. I do some radio frequency there, and I do also all therapy, which is ultrasound treatment. Again, I love it for larger areas. But for some people who have a lot of excess skin, despite the fact that they exercise, they might not necessarily have that much fat even, but you need to remove skin. And I'm always hesitant. There are a lot of people who use threads, and I'm not a huge fan of threads personally, but you can use these threads. And so I think if you're going to go that far, you might as well just remove a little bit of skin.
I'm not a big fan of the threads as well, for the reason that these threads address the skin, and you need sometimes to add more and more and more. And when you end up like doing a surgery, it becomes complicated because you might have them on the way. So myself, I'm not very keen on distress, like you said. The scars, it depends. If the excess of skin is from the armpit to the elbow, I might have to make an incision horizontally. If the excess of skin is just located close to the armpit, we can do an incision just under the armpit or very close from the armpit. So again, the liposuction starts to reduce the fat deposit. We can sometimes support the skin retraction with some radiofrequency treatment, like the body tight, or by the morphers afterwards. And if the excess of skin is there, a smaller incision might be needed. But by combining the treatment of liposuction and radiofrequency, you might be in a position to make a smaller incision, because you have to deal with less fat and less skin.
And is this a new trend? So totally off the subject of fat, but I have a very long forehead, and I've always wanted to have a shorter forehead. But I don't actually want to have higher eyebrows. So I've started to see that people are again offering forehead reductions, which is like this crazy scar that goes along the hairline. So, I mean, is this making a comeback? Have you heard about people asking for this now?
Okay, so I think right now we used to do what we call a coronal incision, as like an incision in the scalps to address the forehead, to try to lift the eyebrow. This is not without risk, and the scars are not the greatest. So I'm not sure I will recommend to get an incision at the limit with the hairline, reducing. Again, it's more like an hairline problem sometimes. So moving the hairline, or maybe thinking about like FEU, I mean like transferring hair, that's something we can do. I mean like, it's again an assessment with the proportion of the face. So this is not a bone that you can shave, the distance that you have between the eyebrow and your hairline, but I will more look at eventually working on the hairlines by bringing hair eventually, than taking some skin.
Then doing it the other way.
Because the skin, I mean, if you take out some skin, you will pull the eyebrow, and you might end up with a funny look.
Yeah, I mean, terrible. I mean, I would hate to look like that. That's just weird. And I already have high eyebrows anyway, just the way my bone structure is. And then a couple people have asked about tear troughs. So I'm going to answer tear troughs since that's sort of my area. So a lot of people complain about having dark circles in their lower eyelid. And it depends. Not all dark circles are created equal. So basically, you can have dark circles from volume loss, where you have a little bit of ptosis of the mid-face, which brings this part of the face downwards. And you can actually see the anatomical tear trough here, which is sort of like this indentation. In people who have that kind of a little bit of volume loss and just fat resorption and just changes in the skeletal skeletal system, adding a little bit of volume, either as a hyaluronic acid or nanofat or, you know, some other, I actually only like those two. I mean, I would never recommend any other injectable treatments for this area, but I would say that that is an excellent way to help with that hollowing. Now, if you have fat prolapse or you have excess skin in lines, sometimes it's better to have a surgical procedure to remove or reposition the fat in the lower eyelid. And sometimes if you have too much extra skin, it's actually, you need to remove some of that extra skin there. So, you know, it all depends on not all eyes are created equal. And so it's just like every other part of the face. It really depends on what your assessment is and what you're trying to achieve. I always say, in my general opinion, I like treatments, and that's why I like, you know, different changes with fat, for instance, is that I like treatments that you can't really tell or pinpoint what's been done, where you just say, oh, you know, I look better, or I look like I've worked out, or I'm more toned, or I look more full, without people knowing. Because I feel sometimes when you cut too young, and unfortunately some people do get a little bit of a scar, that if you cut too young and then you have a scar, it immediately makes you look older. even if you're not. So I always think that having that sort of balance between the two is really important. And of course, having realistic expectations. So you can't expect to have, you know, do all therapy and have, you know, look like a hound dog and then, you know, all of a sudden have a smooth jawline. That's not going to do, you know, that's not going to work either. Sarah's asking us if we do Bella eyes and Fox surgery. I don't believe in those things. So that's sort of like when you take this, and oftentimes they're done with threads or they've had a suspension done. And, you know,
I mean, like we have this question and now because both of us, we have patients from the Middle East and there is sometimes like some new trends coming there. So just, you know, this area, they ask sometime if with the Botox you can lift a lot the eyebrow. There's not much we can lift. The thing is, it's always like an assessment, as you have said, and it's a bit of like skin laxity, a bit of lack of volume, and maybe things we can address with a bit of toxin. But the combination with toxin, a bit with nanofat, a bit of like the filler, I'm not very keen on skin excision, because the skin excision you can do in this area to try to pull the corner of your eyelid might not last, because when you deal only with the skin, probably by less than 2 months, it will come back to where it was. So,
and you could have a little scar in that area, which is not particularly attractive.
Again, some of the face styles bring some of the solution. We need to make sure that, you know, we have like important nerves who are in this area that we obviously don't want to damage. But assessment and maybe using skin tightening, injectables, and a bit of toxin might help, like to achieve the results. Yeah.
Yes. Someone asked what, you know, we discussed Nanofat Transfer, and I'm sure Olivier is going to put this on his Instagram so you can watch it again. And once it's downloaded, we'll put it on up, put it up. But, you know, I think the nice thing about what's happening in aesthetics is that there's a lot of use with your fat and other materials that are not long lasting and, you know, can prolong the time that you need for having surgery. I love the idea of doing knee liposuction, front thigh liposuction. I mean, pretty much anywhere, and then you can use that fat. I also think if you're going to have liposuction, you might as well use the fat somewhere else. I mean, I would never do liposuction and not use it, and not keep that fat, spin that fat, inject that fat. I feel like when you get older,
it's like to become bio-responsible, right? It's a body responsible. No waste. I mean, like,
yeah, no waste. Zero waste. Sustainability.
Exactly.
Exactly.
Yeah, no, everything is good in fat. Actually, we all fight it, but we need fat to survive. Fat is actually a tissue. It's a real factory. And I think if you know how to extract the best of it, this is a way to go. This is definitely the way to go. Like the way we use our blood to extract the platelet, to extract the growth factor for the skin. I think there is what we are doing now is extracting the good cells from the fat and using them for different purposes to try to enrich the fat transfer, to increase the success of the fat transfer, or to use them alone just to boost the skin and to have a bioremodeling effect. I think this is a real game changer. Yes, it took time. It took almost 20 years to get where we are right now. But it's a very, very, very interesting time. And again, as we have said before, local anesthetic treatment will be probably what we'll be only able to do for a couple months, few months due to the situation. So again, after this confinement, looking at what we can do with probably a bit of fat can be extracted in a local, a bit of like the refinement, the purification can be done in theater. It's maybe an hour of surgery. It's not under a GA, it's under local. Doing some skin tightening with you, or some Morpheus treatment to support the retraction. All this treatment can help you to feel much better, probably, and you can support them with the plasma. You can bring like the growth factor to support the healing. I think all these holistic treatment are going to become more and more popular.
I think that's the important part to put in, is that it's not one treatment, magic treatment that's going to fix everything. I think it's like it's almost like you have to look at it as, I don't want to say a lifestyle, but it is part of how you treat your body, your face, and a combination of things, because, you know, when you're doing surgery, you're addressing deeper structures. When you're, you know, using other more superficial treatments, you're, you know, you're treating the more superficial skin, topical skin layers. So I think that's really important to know that there's like a place for each one of these treatments, and you don't need all of them, but sometimes, you know, you don't want to do too many things simultaneously, but you can, you know, alternate them to get the best amount for yourselves. Thank you so much, Olivier.
Thank you.
This was fascinating as always.
So sorry for like the iPad thing, and I lost the communication.
You know, just too excited. At least you have another gadget. Not all was lost. We just lost a minute or so.
Thank you, Maryam.
Thank you. And see you soon. Keep safe. Bye, guys.